Good afternoon. I want to say hi to everybody that's out there. It's a beautiful day here in Duluth. Hope it's very nice where you are. And I want to thank everybody for joining us here today. We have a lot of information to share with you today, and the information we're sharing is based upon the questions that you provided for us during the last several times that we've done this. First thing I want to do is I want to say thank you on behalf of the leadership team here. Thank you on behalf of your colleagues, and thank you on behalf of the communities we're privileged to serve. It's been very nice. Almost every day, someone sends me either something like this, where you see somebody put a little note underneath somebody's windshield wiper, or a chalk drawing in front of the door someplace, where the community is reaching out and thanking us for the work that we do. I think this appreciation is always there, but I think we're becoming more practiced in our appreciation, and people are much more willing to jump out and really thank us. And let's make sure that when we have an opportunity to serve our patients, that we thank them as well. Because in many of the markets that we serve, they have other choices that they could make. And their trust in us to take care of them is very, very important to us and our ability to care for our patients, their families, and our communities. Today, we're going to talk about PPE conservation and reuse based upon questions that were asked. There'll be other PPE questions there as well. And we're very fortunate to have members of our HR team here today to answer some HR related questions and some additional questions. And as always, at the end of this, we'll be showing a email mailbox where you can send additional questions as we go forward. So with this, I would like to turn it over to our colleagues, Pat DeLong, an RN and Chief Nursing Officer over in Brainerd, and then Carly Matthews, one of our sterile processing managers, to bring us up to speed on where we are right now and answer some of the questions that you had. So with that, Pat, I will change the slide and turn it over to you.
Thank you, Dr. Herman. Carly and I are really appreciative of the opportunity to spend a few minutes talking about PPE with you. And one thing we want to talk about in our conservation and reuse program is procuring it, because obviously we can't conserve it if we don't have it. So it was very interesting to me as we started this COVID work to learn the depth of experience and skill we have in our supply chain department. And every day I get to interact with colleagues who are working incredibly hard to look at multiple places to find PPE for us, to navigate the waters where everyone's competing for the same PPE, and to look at all those supply chains that are tight everywhere and work miracles to bring PPE supplies into our organization. That being said, as successful as they are, we, as every other healthcare facility in this country, are very challenged with our PPE, and so conserving and reusing are very important elements of our program. If we could go to the next slide. Thank you. So one thing that we've had lots of questions about is the whole N95 mask conservation program. And we're using right now across our markets ultraviolet light disinfection. And we thought it would be a really good opportunity to go a little more in depth and tell you about that process, so that you can have confidence in the measures that we're taking in our conservation program. So at this point, I'll ask Carly, who's an expert at this, to walk us through the next several slides and look at this process in more depth.
Hi everyone, my name is Carly Matthews. I am a sterile processing manager here at St. Mary's Medical Center. And one of the things that we have been working on diligently is providing decontaminated masks for your use. And we wanted to make sure that we had masks that are as safe as possible for your use. One thing that we've been using is the Xenex system. What's interesting about that is it uses pulse xenon light. So it's UV wavelengths from about 200 to 280 nanometers. That incorporates all the germicidal wavelengths, including those that are best known to deactivate RNA and DNA strands. The robot has been shown to deactivate viruses and bacteria as well as spores in as little as 5 minutes without damaging materials or equipment. So what's nice about the process that we're using is we're exposing both sides of the mask that you are wearing for 5 minutes. And what 3M has found in a study is that they can be used up to they can be decontaminated with the xenon light up to 10 times, and they still pass the filtration as well as the fit tests. Next slide, please. When we receive the mask shouldn't be soiled or damaged, so please make sure that you are mindful of the amount of makeup that you're wearing when you are wearing these masks. Makeup does have SPF in them, so they do keep the UV light from getting to that surface and cleaning it appropriately. Also, please do not write directly on the mask because that can damage the filter itself. We ask that you include a tag like shown here with your first initial, last name, and then the floor you would like it to be returned to. And the reason why I specify being returned to is if you are a 6 West nurse, but you're floating to 3 East for any reason, and you want it returned to 6 West, as long as 6 West is on there, that is where the mask will go to. So we'll go back to that nurse's station there. And please help us also by writing it as legibly as possible so we can make sure that we can get it back to you. One thing to note is that we do not collect regular surgical masks at this time, nor face shields. We have received some of those, but we will wipe them down and return them. But that's something that can be handled on the floor as well. Right now, if you get into the West, market is going to be using vaporized hydrogen peroxide system. It's another thing that has been given the A-OK by the FDA to be used to decontaminate these masks. It is approved for up to 10 cycles, just like the UV light disinfection. Unfortunately, we do not have this exact system in the East and Central markets at this time, and we're unable to purchase them due to backorder restrictions. So that's something that we can't look at here, but definitely the West will be utilizing that. And then when you do receive your mask back, one of the biggest things to remember when you are putting it back on is to check for fit. That is one of the large parts of the standard work. So be sure to check for the seal. So put it on your face. Make sure that when you take in a deep breath, the front of the mask doesn't collapse on you. And also when you exhale, you don't feel air escaping, especially around your eyes. If you do, then that seal isn't there. So try to fit it a little bit better. Otherwise, I will send it back to Pat.
Thanks a lot, Carly. I found that to be really helpful. There's one other point we really wanted to talk about related to PPE, and that is the rate at which the recommendations for how we use and how we conserve our PPE changes. It feels as though, and I'm sure you're noticing the frustration at having the rules change every other day. We know that that is concerning, but we want you to have confidence in the fact that the reason that's happening is that as COVID progresses across the country, there are tons of learnings. And as this is happening, manufacturers are doing intense studies on their products. The CDC is regularly updating their guidance. So those changes are actually good things, and they're getting us closer and closer to being as safe as we can possibly be. So we ask your thoughtfulness and your realization that this isn't a lack of attention when we change things. Rather, it's the opposite. We're trying to pay very close attention and make sure that we're very responsive to changes as they occur across the country. Next slide, please. So with that thought in mind, that everything's changing, we thought we should point out one of our latest changes. And as Carly pointed out, we can't use UV light on surgical masks, but what we can do is follow CDC guidance to reuse those. And we had originally a 72-hour reuse policy. We are extending that per CDC guidance now to be 5 days. So we're asking that for those of you who wear surgical masks, please collect a collection of 5 of them and follow the bagging and the reuse and rest process. We feel that this is the very safest way to reuse this supply at this time. So we also know that your safety is fundamental to everything. Those people who are caring for our patients and who are in contact with patients in any way need to be safe for us to carry out our mission of caring for our families, our communities. So we will continue to be diligent and try to make sure that we balance using the PPE we have now in a responsible way, but definitely conserving it so that when the surge hits our facilities, we have everything you need to be kept safe while you're caring for patients. So we thank you for doing your part. Thank you for your questions. Keep them coming. But we're going to work very hard to make sure that every staff member at Essentia is well cared for from a PPE perspective.
So we've answered some of those PPE questions, and then we'll have some other PPE questions here that have come forward as well. So Pat, I'll go to the next one. I think that one's yours.
Okay, yes, thanks, Dr. Herman. We have had questions about the wearing of masks outside patient locations. And especially some people have asked that if I work in a building that doesn't even have patients in it, do I still need to wear a mask? And our guidance on that is really asking that we all follow the CDC public health recommendation for the use of cloth masks. And specifically, they're recommending that use anywhere where it's difficult to maintain social distancing. So you need to judge in your work location, but in general, if you're in contact with any other colleague or the public at all, we want every single Essentia colleague masked. And I would ask you as healthcare workers to really set an example in our communities. When you go to the grocery store, when you're at the gas station, if you're going to go in, make sure you're setting a good example and wearing the cloth mask. The social distancing impact that we've had in Minnesota is nothing less than phenomenal. It has and I hope will continue to save many, many lives of people who are our family members and our community members. And between masking and social distancing, it's a powerful thing. So let's set a great example. We've had questions also about shoe and head covers, and you can go to the next slide, please, Dr. Herman. Head covering and shoe coverings we use in our OR settings, and we know that we have supply to permit us to continue to do that. When we look at CDC guidance, there is no guidance requiring shoe covers or caps for direct care of COVID patients. Because we know that those supplies come from overseas and they are very limited in the allocations hospitals are getting, unless there's other guidance to the contrary, we'll continue that what we need for PPE for direct care of COVID patients is mask, face shield, gloves, and a gown. And we won't be using shoe covers and bouffant caps at this time. So hopefully that answers that one. Thank you, Dr. Herman.
Thank you, Pat. There's another question that I think is a very good question. I'll try to answer that. It says, is there any plan to build up a larger PPE stockpile? I would think having a 3 to 5 year supply on hand would be a good idea. More PAPRs as well. I think we should be prepared for any type of pandemic. We could rotate out of stock for use so none of it expires and go to waste, but this would protect us from a scramble for the next pandemic. And that's a great thought and a great idea. Let me tell you why we didn't have that and why really nobody had that. And this goes back, which seems like a long time ago, to when the United States was threatened with the Ebola pandemic. One of the decisions that was made at that particular time is that if we all ran out and grabbed PPE and put them in a stockpile, that perhaps they wouldn't be at a place that was needed for them to be. And so the federal government decided that they would put up a thing that's called the Strategic National Stockpile, and this stuff would be placed in that Strategic National Stockpile should we have a pandemic. Well, somehow or another, as things happen, and I think it happens in our lives as well as it happens in the government, is that the further you get away from something, you kind of forget about it. And what happens is that when you're trying to spend money on other things, and no one wants to spend more money on taxation, sometimes things get a little bit left behind. So the Strategic National Stockpile really didn't have that in there. Organizations didn't do that because we were directed at that particular time not to do that, and for other good reasons as well. Money that we spend on providing with our own stockpile just sits there, and that would be literally millions of dollars, and that's millions of dollars that can't be used in any other way at a particular time for the care of our patient, for buying the new CT scanner, for replacing other equipment and other things within the organization. I would have to say that it's very likely that this will be revisited in the future. I think we are learning a lot from this, and we can get a lot better at doing this. All of us wish right now that we would have had a 3 to 5 year supply on hand and be able to do that. But there were very logical and good reasons that this didn't happen at the particular time. But I can assure you that both on a local level and on a state and national level, that those decisions will be revisited in the future. With that, before we go to other questions on PPE or others, I'd like to turn it over to Sarah Carlson with some HR related questions to help answer the questions that you've sent to us going forward. Sarah, I'll turn it over to you.
Thanks, Dr. Herman. I think this first question is going to be yours, though.
It is mine. And this is a very good question. What can employees who are put on special administrative leave expect going forward? The time frame for those HR decisions and callbacks is uncertain, and it's really uncertain because the future is so uncertain. We don't know when the surge is going to be. We don't know when we can start again ramping up surgery. I'll have more on that a little bit later, and not just surgery, but on other face-to-face visits and other things going forward. So in reality, we know that we will likely not go back to the way life was back on March of this particular year. So until there's a vaccine or the population develops herd immunity, hotspots will likely develop, and things will start and stop, go forward and go backward. What I can say as a CEO of the organization, that we're doing everything we can to get back to normal operations or full operations, which may be different than they were before, as quickly as possible. We hope that as social distancing decreases, as the economy starts to expand again, that we can call back people in a measured way to bring people forward. But I want to tell you, and I want you to know that we haven't forgotten about you. That's something that we think about each and every day and that we discuss each and every day. So we're still working on that, and we'll continue to give updates on that going forward.
So this next question is really about, it's very similar to the previous one. If my hours have been reduced, how long is that going to continue? And again, the answer is very similar to what Dr. Herman just shared of, we don't know. The future is very uncertain, but one thing we can commit to is sharing information as we learn about it. And so I think having good conversations with your leaders about what their expectations are would be a good place to start there. We also had a question about, will I continue to accrue PTO for how many hours I worked? And the answer to that is yes. We will continue to accrue PTO as we have in the past. And you may have seen the announcement about the PTO changes that we're going to affect in July, changing to January 1st, but that PTO that I would accrue normally will continue to accrue. If we want to go to the next slide. A lot of confusion, or this question really gets at, gosh, we thought we were going to be cross-trained and now there seems to be confusion, and some people are saying, yes, we need everyone cross-trained, and others are saying, no, only a select few will be cross-trained. And I think this has a lot to do with when we first started working on the planning for COVID-19, we were expecting a large surge of patients in a fairly short period of time, and we were doing everything we could to prepare for that. Then we saw actions taken that Pat referred to earlier in Minnesota and in other parts of our service areas where we did a really great job of slowing the spread of COVID-19 through social distancing and staying at home. And now we know that, or our models are showing that our surge is further out. And so as we've looked at our training plans and our surge plans, we know it's really important that people receive the training they need closer to when those skills will be put to use. And so we're reevaluating those training plans to make sure that as we do call people back in to be redeployed, they feel comfortable and those skills have been refreshed, not months prior, but in a more time frame that will assist in those skills. We also know that redeployment is a really important part of our ability to meet our patients' needs and our community's needs. And so we've asked our nurses in particular, as well as our physicians and advanced practitioners, to fill out a survey around what are your skills, doing some self-assessment so that when we do get to that redeployment, we can use that information to best match your skill set with the needs that we have as an organization. And then the last question that we've been getting a little bit is, gosh, what about my summer vacation? What's the status of that? And we know that vacations are really important to all of us. We need time away to be refreshed and to do our best. We encourage you to still apply for your vacation time, but we recognize that we don't know when we might be experiencing high patient volumes. If it looks like that's going to be happening closer to the time that your vacation was planned, we'll need to have conversations with you about what that means for that vacation.
Thank you very much, Sarah. I know that this is a stressful time for everyone. I see it in the people that I run into when I'm able to sneak into the hospital and other places, and I can see it in our leadership team as well. And some of this stress is because of the uncertainty, and some of the stress is because of long hours and having to respond at a short period of time to a change somewhere along, whether it's in PPE or just the practice in general. But if you are feeling those stresses, our EAP program can help. They can provide assistance with financial concerns, legal questions, as well as confidential emotional support. So it's available 24/7 and open to you and anyone in your household. And there's a number here as well. And with that's out on the HR COVID-19 resources out on our webpage. And so please do not hesitate to use that. That is a service that we've invested in, and we've invested in it because the wellness of our staff and all of us that work together is very important to us. So please do reach out and continue to use that. I'd like to spend a little bit of time now on additional questions that we've had here. Here's a really good question, and something we've spent a lot of time on over the last several days. Since the predictive modeling is suggesting the surge will be happening much later than we had first anticipated, are we going to revisit our decision to resume elective surgeries and clinic visits? And the answer to that is, the short answer is yes, but it's a very complex answer to a very seemingly simple question. One of the reasons that all this elective, or what I would prefer to call non-emergent surgery and procedures, were delayed is because, as we've heard from Pat, we were short, everybody was short on PPE. And in order to have the PPE available to us when the surge occurred, we knew that we would have to preserve, conserve, and reuse PPE. One of the largest uses, discretionary uses of PPE that we have is in those elective procedures. And that was the reason that those procedures were stopped. And that's the reason in the state of Minnesota that there's actually a governor's order that prevents us from just going off and doing this right now. I've had the privilege of being involved in several conversations on this. And as a matter of fact, Jennifer DeCubellis, who is the CEO of Hennepin Healthcare, and myself as the CEO of Essentia Health, were charged with coming up with a plan to allow providers and healthcare providers within the state to start ramping up these non-emergent and time-sensitive procedures. So we did come up with a plan, a draft. I want to thank surgical colleagues here at Essentia Health and surgical colleagues represented by other healthcare organizations in the state to help us come up with about a 6-page document that listed the criteria and the operational considerations that we would need to have in place in order to be able to do that. Some of it's about PPE, as I mentioned. Other of it's about testing. And the recent testing changes that have happened over the last several weeks with our colleagues at the University of Minnesota and at Mayo Clinic working together along with the state to really be able to ramp up testing will allow us to do more testing. What does that allow us to do? That allows us to make sure that patients who can come in for these type of procedures can be tested to make sure that they do not have COVID, and then we're not bringing COVID into our facilities. We also, through our supply chain colleagues, have developed the tracking mechanisms to allow us to determine where are we each day with our PPE. Are we using it more quickly than we have it coming in? And when would we predict that if the supply was going to be cut off right now, or if the supply starts to contract, how much do we have and what type of elective or non-emergent procedures can we perform? So as all those things have come together, we are working on that. Where it sits right now is with the governor's office and with the commissioner of the Minnesota Department of Health. And we had conversations with them again this morning. We are hoping to have a decision from them within the next several days to allow us to do this. What I've asked our teams here in the East and our teams in the West is to work together and build a process. So as soon as we are given the go-ahead, that we can start to resume these type of procedures. That's important for several different reasons. The first consideration is that although these weren't emergent procedures, they were still things that our patients needed to have done. And we know that not doing this threatens the health, livelihood, and well-being of many of the patients for whom these procedures and visits have been put off. This also, secondly, allows us to get back to work. We have spent our lives dedicated to learning our skills, to taking care of our patients, their families, and our communities, and not being able to do that is more than a sense of frustration for us. It's a sense of losing our well-being and some of our purpose. And the third reason is allowing this to come back in will also allow it to give us needed revenue that we need to bring our other healthcare workers and others of us that assist the healthcare workers at the point of care with the patient going forward. So there's many reasons that we want to get this started. There are many things that need to be done in order to do this, but I want you to know that we're working well along our way to try to get this started. Someone else, and several people actually, said, I really appreciate this forum. I hope that we can hear from our leaders in this manner even after the pandemic. And I also think that it's been wonderful for our leadership to show accountability and consideration for our colleagues. Are these live video updates going to be continued? The short answer to that is yes. I think that the more you know about what's going on, the better prepared you can be to continue to move forward. The more that we can inform you and the more that we can get some of the great questions that we just got here, the more that we can better inform you and have that kind of give and take back and forth between leadership and the people that are doing a lot of the work every day. So yes, we will continue to do these. Will we continue to do these with the frequency that we're doing them right now? I don't know. I'll be really frank. The pace that particularly the senior leaders in the organization have been putting up has been literally 12 hours a day, 7 days a week for the last 6 weeks. And it also takes our communications colleagues and others a long time to pull this together. So I think what we will try to do these twice a week for at least the next several weeks to try to get everybody up to speed. We may push these back to once a week after that, but time will tell. But I appreciate the ability to do this. I really appreciate the number of you that show up. I will hear after we're finished with this one this afternoon how many people showed up, but it's literally been over 1,000 for each one of these. And I know that you have other things that you need to do and that you need to take a break. But I want to thank you for your investment in taking the time to hear some of these questions, to hear some of the answers, and to allow us to connect with you through this manner. It's important for us. It helps me maintain my connection with you that I will be very honest, I'm really missing through all of these video meetings, and look forward to getting out and connecting with you much more often in the future. But again, thank you for everything you're doing. As they say, keep those cards and letters and questions coming in. That's important. We want to know what you need to know. We also want to know where we're not hitting the mark in our communications with you. There's a lot of work that's going into the COVID update every day, a lot of work going into the information that goes on the tiles on the COVID page, but we want to make sure that we're meeting your needs as well. So I want to thank everyone that's going to be working this weekend caring for our patients and their families. The rest of you, I hope you take some time off, get outdoors. It's supposed to be a very, very nice weekend. Spring is coming to Essentia Land. So thank you very, very much. Take care of yourselves, take care of your family, and we'll see you again on Tuesday where we'll have some more updates for you then. So again, thank you very much for everything you do. And I look forward to getting together with you again on Tuesday. Bye-bye.